A little over a week ago, an article in the Peoria Journal-Star caught my eye, and it was written by a man named Dr. John Carroll. He's with the organization Haitian Hearts, and he wrote about the first observations of chikungunya that he saw while he was working in Haiti. So I wanted to get him on the air and talk to him a little bit about Haiti and what's going on down there. So I'm very blessed to have Dr. John Carroll. Good morning, John, and thank you for spending some time with me this morning.
Good morning, Robert.
Definitely appreciate the work you're doing down there in Haiti. Let me go ahead and start with, so how long have you been working in Haiti? I saw that you spend several months annually down there, but how long have you been down there in total, and what led you to go down there?
I've been going to Haiti since 1981 when I was a resident, and I just went with a small church group from Peoria, Illinois, and in 1981, and really enjoyed it, enjoyed the tropical medicine, and enjoyed working with the Haitian people primarily, so I just kept going back.
Right. Now, like I said, the article that caught my eye, because I follow infectious diseases quite closely, was your article about chikungunya. I imagine you have an office or a medical clinic in Port-au-Prince and other places, or is it just Port-au-Prince?
It's mainly Port-au-Prince is where I work in a pediatric clinic. However, if I work in Lacaille, I work in a clinic there with Haitian doctors, and in Port-au-Prince it's with Haitian doctors as well.
Yeah, and what I really wanted to do is get your point of view as someone with quote-unquote boots on the ground in Haiti. What are you seeing as far as the chikungunya situation in Haiti?
Well, what I saw in Port-au-Prince a couple of weeks ago were patients who had fevers, headaches, rashes, arthritic complaints. Their joints hurt a lot. My wife and I actually adopted a Haitian baby from an orphanage a few years ago, and before I went to Haiti several weeks ago, I got an email, or I read on Facebook about this orphanage having about 25 kids out of around 100 kids who were suffering from the complaints I just mentioned. And I had just been in the Dominican Republic a few weeks prior to that, and where chikungunya was striking pretty hard, and I wondered if these kids might have chikungunya because the way it was described on Facebook sounded like they could be symptoms consistent with chikungunya. So back in Haiti, I went to the orphanage and examined the kids, and I couldn't find any real focus of infection, and their symptoms were consistent with chikungunya.
Now, is dengue fever a big problem in Haiti?
It is. And chikungunya, as well as dengue, can appear almost the same from a signs and symptoms standpoint.
Sure. Now, as far as the chikungunya, Haiti, I mean, you know Haiti probably better than anybody. Is this place ripe for a massive epidemic?
I think it is completely ripe for a massive epidemic of chikungunya. It is the rainy season now. There's lots of puddles everywhere you go, of course, which would allow mosquitoes to breed, and the sanitation system is very poor. So I think it's very, very ripe for a big epidemic of chikungunya.
Yeah. Let me switch gears a little bit. Of course, as you know, 4 years ago there was the massive earthquake, and cholera has become a huge problem in Haiti, probably more than anywhere else in the world. From your viewpoint on the ground, what's going on with the cholera situation? What do you see?
Well, what I see now in 2014 compared to 2010 and 2011 are much less cases of cholera. I went to a cholera treatment center just a few days ago on the outskirts of Port-au-Prince, and there were no patients with cholera. And I also called Hôpital Albert Schweitzer, which is a hospital in central Haiti, where I worked in 2011, and they having no cases of cholera either as of several weeks ago. I don't know what they're having today, but back in 2011, at one point in the summer, we were getting 300 patients per day in July with cholera. Now, the majority of them weren't severe cholera. Some were mild and some were moderate, but we were getting at some points 300 cases a day. So the numbers of cholera cases have gone down. In approximately 3.5 years' time now, there have been documented 8,500 deaths from cholera. The number has to be much, much higher because so many cases are really never even known about and documented from high up in the mountains out in the countryside, or even deep in the slums in Port-au-Prince and the other major cities.
Sure. About a year ago, I interviewed a physician from Yale who was part of that study about the UN peacekeepers, and she says she expects cholera to be a problem for at least a decade. So you'll have your work cut out for you.
Right.
Sticking with infectious diseases, in Haiti, what are the bigger problems? What do you see more on a regular? I know there's a ton of diseases, but what do you see on a really regular basis?
On a regular basis, especially in a place like Cité Soleil, which is a large slum inside of Port-au-Prince, one sees lots of respiratory diseases in kids, a lot of vomiting and diarrhea, much of that from the dirty water and some just from regular viruses, non-cholera sort of situations. There's lots of skin diseases, Robert, impetigo being very common. Typhoid fever is not uncommon at all, and then there's a whole lot of tuberculosis in Haiti. It's easily passes from respiratory secretions. There's hepatitis. There's pretty much everything you can think of.
Sure. Now, when I talked to you on the phone yesterday briefly, you were mentioning other work that you were doing in Haiti, particularly with the children and rheumatic heart diseases and all that. Can you talk about that a little bit?
Sure. We're a small NGO from Peoria, Illinois. Haitian Hearts is our name, and since 1995 we've been bringing back kids with congenital heart disease and rheumatic heart disease. And congenital heart disease, about 1% of children that are born everywhere really have some sort of congenital heart disease, and Haiti's no different. The problem is there's not the medical infrastructure, the technology to put kids on bypass and repair their hearts in Haiti. So we've been taking them elsewhere, usually the United States, for heart surgery. And then regarding rheumatic fever, that, as you know, is caused by group A, beta hemolytic strep, and probably from the statistics that I know, for every 100 kids that have strep throat in the back of the throat that are untreated, approximately 5% go on to rheumatic heart disease. So a very small percent really go on to rheumatic heart disease, but it's really can be a very serious illness. Not all the time, but when it strikes the heart valves, then it can render the heart very weak, and we frequently see kids, even in their young teenage years, mid-teenage years, in congestive heart failure due to mitral valve disease, due to aortic valve disease from rheumatic heart disease.
John, just from your viewpoint, overall, what is the situation in Haiti in 2014? Not just medically, but just the overall situation.
Well, as I said, I work downstream. I'm really not upstream in Upper Haitian society. So one sees from where one stands, and I would describe it as deplorable. I'd say Haiti's situation is really terrible for the common poor person, the poor family. There is starvation in parts of Haiti, in northeastern Haiti, for sure, and I even see starvation in the slum, which is 2 miles from the guest house from where I live. So that combined with very poor water, potable water, lack of education, and then lack of just the infrastructure, roads, for example, electricity that you can count on. I'd say Haiti's situation is very bad.
Yeah. Well, the reason I was asking is, all of us can read all the stuff in the papers and see the numbers and all that, but you're there, and that's why I wanted to get your perspective on that. And lastly, Haitian Hearts, the organization that you started. If somebody was interested in this organization or interested in helping out financially or with their talents, how would they get a hold of you?
You can go online, and we're at www.haitianhearts.org, and that would be a good way to get hold of us. What we really need regarding bringing kids to the United States for heart surgery is a good pediatric cardiovascular medical center with administration that would be open to operating on a Haitian child. And we would, of course, identify the child in Haiti, send the DVD echocardiogram to the medical center so they can review it. They would know exactly what they're getting regarding to how sick the child is. So we really need good contact with pediatric heart hospitals in the United States.
Outstanding. Well, I've been talking to Dr. John Carroll. He's an internist from Peoria, Illinois, and he operates Haitian Hearts down in Haiti. John, God bless you, and keep up the good work.
Well, thank you, Robert. You keep up your good work, too. It's a pleasure speaking with you.
Thank you, sir. Have a great day.
Thank you.